Hello, and a very warm welcome to you. Thank you for watching Westferry Times. Today, we're diving deep into something absolutely vital, I think, to all of us here in the UK, the future of the NHS.
Hmm.
It's so much more than just, a healthcare system, isn't it? It feels like a really cherished national institution. People often call it the backbone of British
Oh,
society.
that's right. It absolutely is.
But let's be honest, the NHS is facing some serious challenges right now. We're talking about underfunding, big staff shortages, demand that just keeps rising, and some really deep systemic issues.
Absolutely. That NHS finds itself at a really crucial point, I'd say. And to even start thinking about a sustainable future, we need to properly get to grips with, all these pressures.
Exactly. And who better to help us navigate this complex picture than Dr. James Atwood? He's a healthcare policy analyst and, crucially, has experience as a former NHS clinician. Welcome.
Thank you. It's good to be here. These are definitely the conversations we need to be having right now.
Great. So, our goal today is pretty clear. We want to unpack these core challenges facing the NHS and, drawing on the information we have, maybe explore the potential paths it could take in the next few years.
Sounds good.
So, let's start with the current state of affairs. Especially post-pandemic, the media has certainly been quite critical, hasn't it?
Oh, yes. And frankly, with good reason.
Yeah.
The NHS is currently navigating what you could only really describe as a perfect storm.
A perfect storm.
Yeah?
Yeah.
We've got a steadily aging population that naturally drives up demand for healthcare. At the same time, the workforce is under just immense strain. Many are still feeling the effects of the pandemic.
Right.
Then you've got the long-standing funding challenges, which are now intensified by rising costs. We're also dealing with infrastructure that in quite a few areas is just not fit for purpose anymore. And on top of all that, a significant and growing need for mental health support.
And the sheer volume of demand is just staggering, isn't it? Those waiting lists seem to be constantly in the news.
The figures are pretty alarming. As of early 2025, we're looking at over 7.5 million people in England alone waiting for appointments, procedures, treatment.
7.5 million.
Yeah, it's a
Yeah.
record high and just really highlights the immense pressure the system's under.
It's hard to even imagine the impact that has on people, on their families. And what about the staff, the people actually making the NHS work? We hear so much about low morale.
Sadly, yes, morale is low and burnout is it's a really pervasive issue. You have incredibly dedicated nurses, doctors, other health professionals.
Hmm.
They feel undervalued, consistently pushed beyond their limits.
Hmm.
The industrial action we've seen over the last couple of years, the strikes, the walkouts, they were, and in many ways, a kind of cry for help,
Yeah.
highlighting just how unsustainable the pressures are. And the emotional toll of the pandemic, that's also left a really lasting mark.
So it feels fair to say the NHS is in a very serious situation. Would you agree with that description, that it's in a prolonged crisis?
Yes, I think I do. I believe that's an accurate assessment. However, and this is important, within this crisis, as difficult as it is, there's also potentially an opportunity for transformation.
Okay.
This moment sort of forces us to really confront the fundamental issues and think about genuine, perhaps quite innovative change. The sheer scale of the challenge, it demands a bold response.
Okay, let's unpack that a bit more then. What are these core systemic challenges that have brought the NHS to this point?
Well, there are several key areas, and they're all interconnected. Firstly, funding. Obvious, perhaps, but crucial. As a publicly funded service, the NHS budget is directly shaped by political decisions, by priorities.
Right.
And over the past decade, we've seen a period of what people often call, real terms, funding stagnation. So basically, while the actual amount of money might have gone up slightly on paper,
Mm-hmm.
its actual buying power, what it can actually deliver in terms of healthcare services, it just didn't keep pace with inflation and the growing needs. It created a kind of systemic deficit.
And it's not just about the total amount of money, is it? It's also about how well those funds are used, the efficiency.
Precisely. Efficiency is absolutely key. Secondly, we have the workforce crisis.
Yeah.
The statistics are, well, they're stark. Over 110,000 vacancies across NHS England alone.
Wow.
We simply don't have enough people to deliver the services needed, and that puts enormous strain on the existing staff.
Mm-hmm.
It's a complex issue of recruitment, training, but crucially, keeping the staff we have. Retention.
It sounds like a really difficult cycle. Staff shortages mean heavier workloads. That leads to burnout, and then that just makes the shortages worse.
Exactly right. A vicious cycle. Thirdly, we need to look at the structural challenges.
Yep.
The NHS was originally designed way back when mainly to deal with acute illnesses,
Okay.
conditions that pop up suddenly, need relatively short-term help. But now, We're facing a reality where we're managing more and more chronic, complex, long-term conditions. And these demand a completely different, much more integrated model of care. It's like trying to use a system designed for um, quick fixes for problems that need ongoing, holistic management. It doesn't quite fit.
That makes perfect sense. Are there cultural factors at play, too, within the NHS itself?
To some extent, yes. I mean, the NHS has this incredibly rich and proud history, and that's a huge strength in many ways. But sometimes that can lead to a bit of resistance to really significant change,
Institutional inertia.
something like that. And while you see pockets of amazing innovation all over the NHS, the speed at which those innovations get adopted and spread across the whole system, well, it varies a lot. Take digital transformation. Some NHS trusts are practically paperless, working really efficiently, while others are still relying heavily on older, less efficient methods. It's inconsistent.
And then, of course, there's the whole debate around the private sector's role. We're seeing more private providers being used to try and cut those huge backlogs. What's your take on that?
Ah, yes. It's a really complex and often quite emotionally charged issue. There are valid arguments on both sides, truly. On one hand, using private sector capacity can offer a short-term fix, potentially. It might help ease some immediate pressure, reduce waiting times for some patients. But the big concern is that this could gradually lead to a sort of two-tier system, where access to timely, high-quality care starts depending more on whether you have money or insurance.
Right. The principle of universality.
Exactly.
Yeah.
And there are also fair questions about accountability and whether profit motives might sometimes conflict with the best interests of patients. It's this real tension, isn't it?
Yeah.
Between the urgent need to clear the backlogs now and protecting those fundamental principles of a universal system free at the point of use.
Okay. Before we move into possible solutions, we wanted to bring in some voices from the front line, the people really living these pressures day in, day out. We have some short pre-recorded clips. Let's have a listen.
Good idea. This provides that vital perspective, grounding our discussion in the reality of delivering care.
Audio clips play sounds of voices discussing burnout, conditions, pride. Those were incredibly powerful accounts. Just hearing those voices, what really stands out to you?
What's most striking, I think, is that unwavering dedication. That profound sense of pride in the NHS that still shines through, even with everything they're facing.
Yes, you can really hear it.
These are people clearly deeply committed to their work, to their patients. But the overwhelming message is, well, they feel incredibly stretched so thin. It really hammers home the point that you just can't run a world-class health service on goodwill and dedication alone.
Wow.
The system urgently needs to give them the resources, the support they need to do their jobs properly, sustainably. It raises a really important question, doesn't it, about how we as a society actually value and support our healthcare workforce.
Absolutely. So let's move on to that crucial question. What needs to change? We've painted a picture of a system facing huge challenges. Is it fixable? That's the big question, isn't it?
Yes, I firmly believe it is fixable. But it's going to demand a really concerted, sustained effort. And probably some difficult but necessary decisions.
Okay, where do we start?
Well, first, we have to tackle funding reform. We need to look beyond these short-term budget cycles. We need a commitment to long-term, properly ring-fenced investment that's genuinely enough to meet the rising demands. And thinking bigger picture, a well-functioning NHS isn't just about health, it's fundamental to society, to the economy, to overall well-being.
And it's not just about pouring in more money, presumably. It needs to be strategic investment.
Precisely. Which brings us to the second critical area, training, and importantly, retaining staff. We need to significantly invest more in educating and training healthcare professionals, doctors, nurses, everyone. But just as vital is making the NHS a place people actually want to work and want to stay working in for the long haul. That means tangibly improving working conditions, offering fair pay and benefits, providing real opportunities for development, for career progression. It touches on that whole culture question again. How are staff actually valued day to day?
It sounds like a fundamental rethink of how care is delivered is also needed.
Absolutely. We need to actively shift more care out of the traditional hospital setting and into communities.
How would that work?
By significantly strengthening primary care GPs, local clinics, expanding community health services that are easy to access, and putting much more emphasis on proactive prevention and catching things early. If we address health issues sooner, we can ultimately reduce the need for the more costly, resource-heavy hospital treatments later on.
And that link between physical and mental health that needs to be much more joined up, I imagine.
Without a doubt. And we also have to break down those silos between health and social care. They're so intrinsically linked. A more seamless, integrated approach would absolutely lead to better results for patients and, frankly, a more efficient use of resources overall. It's about that truly holistic approach, physical health, mental health, social support, all working together.
Technology must have a huge role to play in the future NHS, too.
Oh, the potential is immense. AI, for example, could help with faster, more accurate diagnostics. Proper digital health records, shared effectively, could massively improve communication and efficiency. Telemedicine can broaden access, especially for people in remote areas.
But there are risks, too.
Absolutely crucial point. We have to make sure technology is implemented equitably, that it doesn't accidentally make health inequalities worse. We need to think carefully about access for people who maybe aren't digitally savvy or don't have reliable tech access, particularly older adults. It's fascinating, the speed of tech change, but we need to manage the ethical side carefully.
And finally, the politics of it all. There seems to be massive public support for the NHS's core ideas, but also real nervousness around anything that smells like privatization.
That's spot on. While pretty much everyone agrees on the fundamental importance of a public, universal NHS, navigating the political sensitivities around any reforms is, well, it's a huge ongoing challenge.
So what's needed?
Ultimately, brave leadership and really clear, transparent communication to build and keep public trust for the changes that are needed, even the difficult ones. It raises that critical question: how do we get genuine cross-party agreement on a long-term vision for the NHS? Something that lasts longer than one election cycle.
So let's try and look ahead. Let's paint a picture. The NHS in, say, 2040. What could it look like in an ideal scenario?
Okay, ideal scenario. NHS 2040 is truly integrated, genuinely proactive, and highly personalized. Imagine a health service using clever data analysis to predict health issues before they get serious, allowing for early, effective intervention. Care delivered more and more in people's own homes, in their communities, using technology for remote monitoring, providing tailored support. Mental health given exactly the same priority, the same ease of access as physical health. Ultimately, a service built truly around the individual, their specific needs for health and well-being.
That sounds really positive, encouraging. Do you think that vision is actually achievable?
Yes, I do.
Yep.
Really believe it is. We have the talent in the workforce, incredible talent. We have the technology advancing all the time. And we have that enduring public will, that support for the NHS.
So what's missing?
What's absolutely crucial is developing and then sticking to a clear, long-term vision, one that goes beyond short-term politics. We need that roadmap and the sustained, consistent investment to actually make it happen.
And your own belief, despite all the challenges we've talked about, your belief in the NHS's core principles remains strong.
Absolutely. The core principles: healthcare free at the point of use, based on need, not ability to pay. They are more vital now than ever, I'd argue. But as I've said, belief alone isn't enough. We need decisive, sustained action to ensure it survives, and not just survives, but actually thrives in the years ahead.
Dr. James Atwood, thank you so, so much for your incredibly insightful, very honest, and really thought-provoking perspectives on the future of the NHS. That's all the time we have for this deep dive today here on Westferry Times.
My pleasure entirely. Such an important conversation, one we all need to keep having.
And to all of you watching, if this deep dive resonated with you, please do share it with others. Let's keep this important conversation going. And do not forget to join Westferry Times channel for more in-depth discussions on the issues that matter. Thank you so much for tuning in today.
Thank you.